Hello, hi. So I'm going to demonstrate how you would carry out the orthopedics examination of the shoulder using our script-wise approach. Now remember, you would have to go through wiper and the relevant parts of IPPA. With that said, it's something important with all musculoskeletal or orthopedics examination, and that is what has been described by one of the best orthopedic surgeons, the late Apley. And he described that orthopedics exams are generally carried out through look, feel, move. Now, I have condensed that into because look, feel, move, usually you would require to do some special tests. So I've condensed that into low FIMS, which is L capital, O small letter, F capital, E small letter, M capital, and S capital. So that's look, feel, move, special test. So with this basic on the ground, let's go to the orthopedics exam. So just like everything, you start with looking. You want to look in from the front, you want to look from the side, and you want to look behind. Yeah. So you want to look from behind. So once you've done that, when you're looking behind, you want to ask the patient to do this. The reason is because of winging of the scapula. All right, and because the scapula generally is considered as an integral part of the orthopedic shoulder joint. Now, once you've inspected, you want to now go on to palpate. Now, you want to palpate for several things like differential warmth. You want to do that on both sides of the shoulder. You want to feel, yeah, you want to feel, yes, and then you want to feel behind as well, on both ends of the shoulder. And then you want to feel the medial end as well. Now, once you felt, you want to go into moving. And moving is, I teach active before passive, meaning the active movement is the movement which the patient does themselves without your interference. So now you want to move the joint in all of its possible planes. So the first thing you want to ask the patient to do is do this and do that. Yeah. Now what you're doing is you're abducting and externally rotating the shoulder. Once they've done that for you, you want to ask them to do this. You want them to have their hands as high up as possible. Yeah. Now, once you've done that, you want to test the range of movement this way. And then you want to ask them to do that. Okay. Once you've done that, you want to test the range of movement sideways. So you want to ask them to do this, that, and then go across the body that way. Okay. Once you've asked them to do that, you want to ask them to do this and that, and then that. Good. So this would conclude the active movements by the patient. So after they've done this, you want to ask them to, you want to do the movements for them. So you want to start by, usually most people will start by, you put your hand here and you ask them to do that movement, just assessing winging. Yes, so once you've done that, you now want to go through all of the movements. So you put your hands on the patient's shoulder and you ask them, you move them anterior, posterior, up that way, back, across, like this, that way, sorry, that way, then You try and do that. Yeah. And then try and do that. Feeling the passive movement. So once you've completed the passive movement, what is remaining is the special test. Now, at the Academy, we like to make things simple, and we've created the term PI for the special test. So P is the painful arc, painful arc, painful arc, painful impingement arc test. I is the internal rotation against resistance. E is the empty can test. And then E is the external rotation against resistance. So there are 4 special tests. In an examination, you probably should be able to demonstrate 1 if you're a medical student, at least 2 if you're a postgraduate student, all the 4 if you're specializing in orthopedics. So the first is the painful arc. So the painful arc is you help the patient to raise their hand up, and then you ask them to bring it back like that. So they would feel a pain in the arc. The next is the internal rotation against resistance. And what you're doing is you are asking the patient to do this, and you tell them to push your hands against resistance. That's the internal rotation against resistance. The next is the external rotation. So you ask them to do this. External rotation, you ask them to do this, and you ask them to externally rotate again. So that's external rotation against resistance. Then you ask them to do this and that and prevent you from pushing it down. That's the empty can test. I hope you found this useful. So this would conclude the examination, and you thank the patient. So in summary, you'd go through wiper, IPPA, but not all of it, but adapted to orthopedics is the look, feel, move special test, which I've described as LOFIMS. And after you've gone through that, you go through looking, you go through feeling, you go through movement, which is active before passive, and then you go through the special test, which is easy to remember using the word PI. In terms of special tests, if you are a medical student, you probably should be able to demonstrate 1. If you are a postgraduate surgery learner, at least 2. Specializing in orthopedics, certainly all 4 of them. Thank you for watching.